we presented our phase 3 study Alcanza, and this was the first study that has been presented for the CTCL patients that require a systemic therapy. So these are the patients with advanced disease, and the topical administration of any medicine has not helped those patients, and now they are getting systemic therapy. So this was a very important study for the patients that was presented yesterday. Going further into the Alcanza data, this was a phase 3 study, an open label study, an international study, and it was a randomized study in those patients who required a systemic therapy. These patients had a requirement of at least 10% expression of CD30 in their biopsies, and if those patients qualified, they were randomized to either get Brentuximab Vedotin for 1.8 milligrams every 3 weeks, or they were randomized to get a physician's choice of using either Methotrexate or Bexarotene according to their dosage. The patients were followed for 16 cycles, and then after that, the end of treatment visit was there for these patients. The outcome of the study was analyzed, and it was presented at ASH this year. So the results, for these patients who have advanced cutaneous T-cell lymphoma, the current standard of care doesn't give a lot of options for these patients. The responses are limited, and the duration of response is also very limited. So with this study, we were able to show that those patients who were treated with Brentuximab Vedotin had a statistically significant benefit of the treatment with this drug in comparison to the physician's choice of either Methotrexate or Bexarotene. When we look at the primary endpoint of the study, which was overall response rate that lasts for 4 months, it was statistically significant with a very high p-value, and the values, when you look at the percentages, it was 56.3% for Brentuximab Vedotin compared to 12.5% in the physician's choice arm. Even these key secondary endpoints had a significant outcome for those patients who were treated with Brentuximab Vedotin. When you look at the CR rate, it was 15.6% in comparison to 1.6%. In this disease, getting a CR or a complete remission is very difficult. So for those 15.6% of the patients, getting a CR is a very important outcome in this study. The other endpoints that we looked at are the historical endpoints like progression-free survival, and even there was a significant benefit for these patients. Those patients who were treated with Brentuximab Vedotin had a PFS benefit of 16.7 months in comparison to 3.5 months if a patient got the physician's choice. Also, we looked at the skin responses and the patient reported outcomes, because for these patients their disease is on the skin, so any benefit that they can have with their disease which shows on the skin is really important. So we used a secondary endpoint, a key secondary endpoint called Skindex 29 questionnaire, where the patients responded to these questions, and when we look at that in comparison to the control arm, there was a significant difference in the drop of their Skindex score, and the drop was from 27.96% in comparison to 8.62% for the control arm. So those are very significant outcomes for this study, not only for the primary endpoint of ORR4, but also for the key secondary endpoints. I think we as the Takeda company are really very happy with the results that have come out, and this gives a very important option for the patients who have cutaneous T-cell lymphoma.